This video is about the use of shockwaves for benign prostatic enlargement. Many of you have asked this. Are shockwaves helpful with an enlarged prostate? Short answer, sometimes they are, but not as you may think. Let me break it down for you in this video. At the end, you will know if you could be helped by shockwaves. I'm Dr. Stefan Buntrock, board-certified urologist and specialist in sexual health. Here's a shocking truth up front. I know many of you don't want to hear this. I've said it before and I'll say it again. Benign prostatic enlargement is not a swelling. It is real growth. It's multiplication of cells. Think about puberty. You don't just swell 10 inches taller, you actually grow. Same with the prostate. After a certain age, it starts to grow in many men. It builds up more tissue over time. For many men, this is not a problem. They don't even notice. But for some men, typical symptoms set in. We call these LUTS, lower urinary tract symptoms. These include weak stream, urgency, hesitancy, frequent urination at night, and a few others. The classic model was simple. An enlarged prostate squeezes the urethra and causes LUTS. However, there's a more modern way of looking at the problem. It acknowledges the phenomenon of urethral compression, but that's just one piece of the puzzle. Today we know LUTS can have many causes. An enlarged prostate is just one possibility. During my daily work, I see this all the time. Some men have only slightly enlarged prostates and lots of symptoms, while others have prostates the size of oranges and no problems at all. By the way, a normal prostate is about the size of a chestnut. So my job as a urologist is to figure out whether these symptoms actually come from the prostate or from somewhere else in the urinary tract. If it's the prostate, then I will have to go through some of the criteria that trigger immediate surgery. The risk for urinary retention dominates all other thoughts here. If there is substantial residual urine or urinary retention almost happened in the past, there is no time to lose. It's surgery, period. Some of you may ask now about alternative surgical treatments. This would be a whole new video. Blocking the prostate arteries is a possibility too, but it depends on the individual case. The effects are not as pronounced as with transurethral surgery. In other words, not every prostate would be suitable. But let's move on because I want to address shockwaves in this video. But I wanted you to understand a little about the nature of this disease first. So if the symptoms are bothersome, but there's no risk of urinary retention, then we can talk about other therapies. As a rule, these will be drugs directed at reducing urinary bother. The prostate may even shrink a little when you use finasteride or dutasteride, but don't expect more than 20% over the course of 1 to 2 years. These drugs deprive the prostate of testosterone, so a fraction of the cells simply wither away. Shockwaves and LUTS? Interesting combination, but again, not for everybody. However, subscribing to UroChannel is for everybody. If you like this video so far, subscribe, share, and give the video a like. It doesn't cost you any money, but it is the price of your ticket to first-class urological information. Thank you. Back to shockwaves. When I talk about shockwaves, I'm talking of a certain type of acoustic wave that is focused. Here's the big confusion. In the US especially, devices that generate radial pressure waves using compressed air are often sold as shockwaves. But these are not the same thing. Radial pressure waves behave differently and most likely don't have the same effect. If you are interested, there are a lot of videos on UroChannel about just that confusion. Here's what shockwaves can do for you in a nutshell. They can remove your urgency and improve urinary flow. Here's what shockwaves can't accomplish. They don't reduce the size of your prostate. So why are they effective for urinary urgency in some men? Because this urgency is not caused by the prostate. It is caused by something else. And that brings us to a medical mystery that hasn't been solved yet. And that's where it gets really interesting, because even science doesn't have all the answers. We don't know for sure why these symptoms appear when the prostate is enlarged. By the way, did you know that erectile dysfunction is common among men with lower urinary tract symptoms? Why is that? Science simply doesn't know. However, I have a hypothesis. Experience taught me that pelvic floor overactivity may be the underlying cause, possibly caused by the enlarged prostate. It would explain a lot of things, including why erectile dysfunction might coexist. And it would explain the effects of shockwaves. So yes, if it's about bother in a prostate that doesn't need surgical treatment, shockwaves definitely are an option. One more time, they are not for everyone, and it has to be decided for the individual patient. I can be very strict with this because this is an out-of-pocket treatment and I want a realistic chance of success before I recommend it. Is this an established therapy? Not at all. But you know what? It's easy to perform, tackles the root of the problem, has no known side effects, and doesn't involve any medication. If it doesn't work, well, you haven't done anything that can't be undone. You still have all the options. But it offers the chance for fast and lasting relief. What are the downsides? You can't do it yourself. Health insurance doesn't pay for it, and if you live in the US, the FDA hasn't approved shockwaves for this type of treatment. But what is so special about shockwaves? This video will explain some more of its physical properties, and in case you need a guiding light through the night, my series Urology Noir might be just the thing. Follow me, I know the way.